Hi, my name is Annemarie Newbury and I'm the Violence Prevention Outcomes Officer at Public Health Wales, working in the Wales Violence Prevention Unit. I'm going to talk through the strategic needs assessment we carried out to better understand serious youth violence in the South Wales Police Force area. This includes the established and emerging trends in violence, the cohorts most vulnerable to involvement in violence, the risk and protective factors for violence, and the impact of violence on healthcare services. We define serious youth violence as involving children and young people characterised by knife and gun related crime and homicide, with links to exploitative crimes such as modern slavery, sexual exploitation, and crimes related to the drug market. For the strategic needs assessment, we've collated data from a range of different sources to capture a picture of serious youth violence in South Wales. This includes data that is easily accessible to the public, such as ONS data and Stats Wales. South Wales Police provided analysis and data from police systems and intelligence, and we use data from the violence surveillance system, including police, A&E and ambulance data. We've also incorporated information from the literature and qualitative data from interviews and focus groups. The Wales VPU commissioned Liverpool John Moores to estimate the cost of violence to healthcare services in Wales. Cost of illness analysis was used, drawing together data on healthcare required for different forms of violence, including aftercare for physical and psychological well-being. It is estimated that the cost of violence to the healthcare services in Wales is £4.6 million a year. As you can see from the graphs, there is a significant span on both ambulance, A&E care and hospital stays, as well as counselling support. The Home Office provided South Wales Police with the funding to set up the Violence Prevention Unit. For a bit of local context, South Wales Police is one of 4 police forces in Wales. Geographically, the police force covers 10% of Wales, yet serves 42% of the population, which is approximately 1.32 million people, so it's a fairly densely populated area. There are 7 local authorities: Cardiff, Vale of Glamorgan, Rhondda and Taff, Merthyr Tydfil, Swansea, Bridgend and Neath Port Talbot. There are also 3 health boards: Swansea Bay, Cardiff and Vale and Cwm Taff. South Wales Police is the 5th strongest police force in England and Wales in terms of the number of officers per population ratio. There are 5,460 police officers and staff in force. According to the 2011 consensus, South Wales isn't a particularly diverse area, with 90% of the population identifying as white British. For Cardiff, this is a little bit more diverse, with 85% white. However, the majority of local authorities in South Wales have a population of 95% and above white. South Wales has a large student population due to the number of universities hosted within force. As such, South Wales has a higher representation of 16 to 24-year-olds, and areas such as Cardiff have a lower mean age than England and Wales. To better understand serious youth violence in Wales, we've explored the literature to identify the risk and protective factors. We have mapped these against a social-ecological model. Research has highlighted that individual factors can increase the risk of a person becoming involved in violence, including the demographic profile, such as age, gender and ethnicity, psychological and behaviour characteristics, and educational outcomes. Furthermore, the type of relationships an individual may have with friends or family can increase or decrease the risk of involvement in violence, as well as community and societal factors such as social inequality and deprivation. We have explored data sets to understand how the risk factors of serious youth violence will present at a population level in South Wales. The literature suggests that violence is more prevalent in younger cohorts. This is supported by South Wales Police data, which highlights that both violence perpetration and victimisation is more prevalent among white males aged under 30 years. Do talk a little bit more about this later on. Low academic achievement is common among individuals involved in violence. The data highlights that many children do not achieve level 2 at GCSE, so that's 5 A star to C grades in Wales. 29% of children eligible for free school meals do not achieve A star to C grades in core subjects such as maths and English. These figures are particularly low in areas such as Merthyr and the Rhondda and Taff. Behaviour characteristics such as ADHD and impulsivity are also identified as risk factors. While punishment exclusions are relatively low in South Wales, fixed-term exclusions are fairly high, with over 7,000 reported within the period of a year. Physical violence is one of the most common reasons for schools taking this punitive action. There is a large evidence base which demonstrates the link between early childhood experiences such as abuse and on violence and outcomes in later life. In South Wales, we have almost 1,500 children on the Child Protection Register. A third of these reside in one local authority, so that's it, Rhondda and Taff. There are over 3,000 looked after children. A quarter of these are in residential settings. There are high levels of deprivation in South Wales. Of the 100 most deprived communities in Wales, 60 of these fall within the South Wales Police Force area. 78% of the working age population are in employment. although we have a high student population. 3% of the population are on universal credit. There has been a lot of research to understand adverse childhood experiences. Wales has very much been on the forefront of developing the evidence base around the impact early childhood trauma can have on outcomes in later life. The research supports the association between ACEs and health harming behaviours, including alcohol and drug use, violence and incarceration. The ACE prison study further enhanced our understanding of ACEs in more vulnerable populations, which highlights that exposure to ACEs in the offending population is high. However, reducing ACEs and mitigating the impact of these experiences can have significant benefits across a range of outcomes. Most notably, it has a potential to reduce incarceration by 65%, drug use by 66%, violence perpetration by 60%, and victimisation of violence by 57%. In Wales, we have taken great strides turning the learning from the ACEs research into practice. There has been a lot of investment from the Home Office and Welsh Government to drive forward the ACE agenda. Efforts such as the Early Action Together programme and the ACE Support Hub has worked to develop ACE-informed whole systems responses to vulnerability in Wales, which drive forward early intervention and prevention. This provides a strong foundation for the Violence Prevention Unit to enable a public health approach to violence. Okay, so onto police data then. Wales has a higher rate of violence than the average for England, with 31.4 crimes per 1,000 population. Wales-wide, violence and sexual offences account for around 31% of all crime demand. This is fairly consistent across the 4 police forces in Wales. While South Wales has the highest volume of violent crimes, in terms of its population ratio, it is the 3rd highest, so North Wales and Gwent do have higher population rates of violent crimes. We know that approximately 1 in 4 women and 1 in 6 men will be affected by domestic abuse in their lifetime. Based on these statistics and the population size, we estimate that over 500,000 adults in Wales would be affected by domestic abuse. The population rate for police recorded domestic-related incidents is higher in Wales than for the average for England and Wales. Gwent has the 2nd highest rate of domestic abuse incidents reported in England and Wales, with 41 per 1,000 population. However, this may be a result of higher levels of reporting as opposed to a higher prevalence. In South Wales, there were 38,735 crimes for violence against a person recorded within a period of a year. Violence with injury is more prevalent in Cwmtaf and Cardiff, as well as Swansea. There has been an increase in volume of crime reported in the last 5 years across all local authority areas. Cardiff and Swansea has seen the lowest increase in volume of crimes reported across South Wales. However, the number of crimes reported within these areas remain consistently higher. Across England and Wales, offences involving knives have risen to an all-time high. Over 45,000 offences were reported within a period of a year, January to December 2019. This is a 49% increase since March 2011. In South Wales, 1,388 occurrences were recorded within a period of a year. 83% of this was for possession of a knife and 18% for use of a knife. There are noticeable peaks of knife crime occurrences on the weekends, including Friday, Saturday and Sunday. Almost half of the demand within the force is for Eastern BCU, which is Cardiff. So looking at some of the characteristics of victims and perpetrators of knife crime, we can see that there are a lot of similarities between the two. The majority of both victims and perpetrators are males and white British. A lot of them fall within the 16 to 25 age category. Also, many of these were already known to the police, so 85% of perpetrators were already known, with multiple flags and markers, including flags for violence against another person, drug offences. There is also mental health and domestic abuse markers there as well. The level of gun crime in the UK is one of the lowest in the world. In Wales, gun crime has declined by 5% in the last year. In South Wales, there were 145 offences involving guns, so this was mostly firearms, BB guns, stun guns and imitation firearms. 33 of the offences were reported to be use of the weapon. There has been no homicides recorded as a result of guns since 2015 in the South Wales Police Force area. Similar to knife crime, there are a lot of similarities between the victims and perpetrators of gun crime. Predominantly, the perpetrators are white British and male. Over half of the perpetrators fell within the 16 to 24-year-old age category. 83% of perpetrators previously known for violence against a person offences, 62% for drug offences and 53% for damage occurrence, so vandalism, for example. Half of the perpetrators were also previously known as victims of violence. The victims of gun crime were of similar profile to the perpetrators, predominantly white British male, aged 16 to 24 years old. Many of these individuals are also known to the police as a victim or a perpetrator previously, or both. There were strong links between gun crime and drugs, as well as drug markers. 10 individuals were on the forced county line tracker. So this data really highlights that much of the violence stems from male and male violence, such as gang-related violence and drug-related violence. Nationally, homicides are at an all-time high for the past decade. 732 lives were lost across England and Wales in the year ending December 2018. In South Wales, 12 homicides were recorded within a period of a year, 5 of which were domestic related. The vast majority of victims and perpetrators of homicides were male. Of the female victims, all of them were killed by a partner or ex-partner. Men were more likely to be killed by friends or acquaintances than females. So looking at the non-domestic homicides, the rise in non-domestic homicide is driven by male-on-male cases rather than violence against women and girls. All 13 perpetrators were previously known to the police as a perpetrator. On average, 14 additional occurrences were linked to them. 6 of the 7 victims were previously known to the police as either a victim or perpetrator. Both victims and perpetrators had multiple flags and markers attached to their record, including violence, drugs and weapons. 9 homicide perpetrators and 3 victims had drug warnings attached to their records, and 1 perpetrator and 1 victim were on the county lines tracker. So looking at some health data that we have available through our violence surveillance system, so this incorporates police, A&E and ambulance data. Between January 2017 and December 2019, there were 13,799 A&E SILTs attendances across South Wales. Overall, there was a small decline in the number of assault attendees, with 4% reduction in A&E assault attendances from 2017 to 2019. Peak attendance in A&E due to assault-related injuries were between June and July, although this did vary per year. Those aged 18 to 34 remained the most prevalent age group for assault attendances. However, there was a reduction in assault attendances for males in the age 18 to 24 and 25 to 34 categories. Female assault attendants were on average older than male attendees. Between 2017 and 2019, there has been a 10% reduction in those 25 years and younger attending A&E with an assault. So the majority of assault attendances reported to A&E departments were not as a result of weapons. Overall, 2% of the assault attendances were reported to be a result of knife crime over the 3 years. 7% were to be a result of sharp object, such as bottle or knife. Incidents of assault attendances to A&E reported knives as an assault weapon has decreased by 30% over the last 3 years. However, it's not known whether some of the knife-related incidents were recorded under the sharp object category. Of those individuals reporting to A&E with a knife-related injury, 88% were male. 61% of knife assault attendances were those aged between 18 and 34 years. Over half, so 53% of knife injury assault attendees reported to A&E on a weekend, Friday to Sunday, with peak attendances early hours Sunday. This reflects police data findings that highlight a peak in reported knife crime on the weekends. The A&E arrival time of 42% of the knife-related assaults fall between 2200 hours and 4 o'clock in the morning. So looking at the data that we have available to us on the offending population, England and Wales has the highest incarceration rate for Western Europe. This is slightly higher in Wales than it is in England. There are 5,091 incarcerated men in Wales, but it's anticipated that approximately 33% of the Welsh prisoners are incarcerated in establishments outside of Wales. A significant portion of men in Wales are incarcerated for violence against a person, drug offences, possession of a weapon, and sex offences. Across England and Wales, there is a high level of violence in prison establishments, and there's been a 139% increase in violence since 2010. So in 2018, there was 34,000 incidents reported, 5% of which were in Wales. A third of these incidents are towards staff members. Both victims and perpetrators are often aged 15 to 24 years. 50% of prisoners reported feeling unsafe within the prison establishments, and self-harm rates are at a record high. So there's over 55,000 incidents of self-harm reported across England and Wales, and this is concerning just over 12,000 prisoners, which highlights that there's a lot of repeat self-harm within the prisons. self-inflicted deaths are more common for prisoners incarcerated for violence against a person. So there are high rates of recidivism in the UK, especially in Wales. The framework to support positive change highlights that the annual cost of reoffending in the UK is estimated to be £7 to £10 billion a year. There are some risk factors that have been highlighted, including accommodation, education, training and employability, lifestyle and associates, relationships, drugs and alcohol, and attitude and behaviours. In Wales, there are 15,570 offenders under supervision with MPS and CRC, so National Probation Service and the private sector, the Community Rehabilitation Company. For violence against a person and drug offences, 25% reoffend within a year of release. A third of offenders reoffend following possession of weapon offences. UK-wide, within a year of release, prisoners reoffend on average 4 offences, with 20 previous offences. In South Wales, this is slightly higher, particularly in Cardiff. 40% reoffend with an average of 29 previous offences. And with Swansea, 34% reoffend within the year, and an average of 27 previous offences for those individuals. So within the VPU, we're delivering some work on co-production to help inform violence prevention in Wales. We've commissioned Bernardes and Cardiff University to carry out a piece of research into co-production, and we've also carried out some focus groups with Operation Sceptre, which is a policing team that is working at preventing violence and drugs within South Wales. So from the police perspective, the drug market is causing increases in violence such as knife crime. Operation Sceptre are responding to violence caused by gang activity and territorial disputes. Areas with nighttime economy and student population are hotspots due to the transient and diverse nature of the community. Police are aware of tactics used to avoid police detection, such as exploiting children or using women, which is increasing youth violence. So one officer has highlighted that often young people will carry knives because they don't have a physical profile to protect themselves on the street, particularly against other gang members. There was some work done with young offenders within prison establishment, and these young offenders highlighted that there's an increased interest in selling drugs in Wales because of less competition in the drug market. Dealers from other areas such as London and Birmingham will move to Wales using tactics from their own areas. This is likely to cause a rise in violence, including gun crime, particularly as their competition will rise within the drug market. So talking to some young people from the community, they stated that they do not feel safe as their communities are perceived to be unsafe, and at home they've experienced abuse, neglect and domestic violence. These had all witnessed violence, including knife crime, which they would not report to local authority figures due to concerns about trust and them not acting on what was reported. The young people recognise peers as being unsafe and negative influences. Younger children and females are used to run drugs to avoid detection, using children who are not considered criminally responsible, or using young people during the day rather than an evening, so they're considered to be absconding rather than missing. Child sexual exploitation and child criminal exploitation are prevalent and often coexist, but those young people do not receive gifts, rather their safety and family are threatened. So we have a number of recommendations which we have put forward as a result of our strategic needs assessment. There's some recommendations around data analysis which we'd like to take forward. So we want further data analysis to be carried out to understand population profiles at a local level of those who report serious violence to the police within the health data, and to conduct predictive modelling of serious youth violence within the Welsh communities. Further analysis of specific hotspot areas of serious violence across South Wales to inform and enable partners to develop targeted intervention and prevention strategies. We also would like to explore some more innovative models to establish total prevalence of serious youth violence. And we would like a Wales-wide strategic needs assessment on violence against women, girls, domestic and sexual violence and abuse. Further consideration for gang involvement in county lines in relation to serious youth violence and the current drugs market in Wales. We recommend a specific needs assessment and problem profile on these issues. So with regards to research, we'd like to carry out some research to realise the cost benefits and cost avoidance of violence prevention to services and address the cost of violence to wider systems such as the criminal justice and social care systems. On the risk and protective factors and effective community-based interventions. So this is to include how gender, ethnicity, inequality and how wider factors will interplay. We also think research is needed on how social media enables serious youth violence, how violence and abuse are experienced online, and the effectiveness of social media interventions. And lastly, we have some recommendations for partnership working. So as a priority for future partnership working, the VP lead on developing a whole systems response to data sharing to include, in the first instance, engagement with partners to understand what data is collected and how it can be used, and also to undertake further work with education partners and the voluntary sector to secure appropriate levels of data to allow us analyse and more accurate understanding of serious youth violence and what interventions are effective in preventing serious youth violence in education settings. So that's all for me. Thank you for taking the time to listen. I hope this is useful. If you'd like some more information on serious youth violence, please look at some of the links that we have available on the webpage. Thank you.